Okay, so if you're a man over 50, maybe you're finding yourself making more trips to the bathroom than you used to.
Right. Or noticing the stream isn't what it once was.
Exactly.
Yeah.
Or maybe that feeling like you just can't quite empty your bladder fully. It's frustrating, no doubt.
Very common, though.
Yeah.
And the good news is you're definitely not alone, and there are ways to manage it effectively.
That's what we're diving into today, right? Benign prostatic hyperplasia, BPH.
Precisely. Understanding what it is and how to manage it. An enlarged prostate, basically.
So what's actually happening there? With the prostate, I mean.
Well, benign means it's not cancer, which is key.
Yeah.
But hyperplasia means enlargement. The prostate gland, it sits around the urethra.
The tube that urine comes out of.
Exactly. So as the prostate gets bigger, it starts to squeeze that tube.
And that squeeze causes all those urinary symptoms we mentioned.
That's the core issue, yes. The pressure leads to trouble with flow, frequency, urgency, all of it.
And you said it's not cancer, but it can still cause problems if you just ignore it.
Oh, absolutely. It's not life-threatening in itself, but the impact on quality of life can be huge. Sleep disruption, limiting travel or activities.
Yeah, I can see that.
And if left untreated long enough, it can lead to more serious complications down the road. Bladder issues, infections, even kidney problems in some cases.
Wow. Okay. So how common are we talking here? It feels like you hear about it a lot.
Incredibly common. The stats are pretty striking. About 50% of men in their 50s have some degree of BPH.
Half? Really?
Yeah, and it goes up with age. By the time men hit their 80s, it could be as high as 90%.
90%. Okay, so understanding this is pretty crucial then.
Definitely. Being proactive makes a big difference.
So for this deep dive, what are we covering? What can listeners expect?
We've pulled together info from our sources to give a full picture.
Yeah.
We'll look at the causes, why it happens, then the symptoms, what to look out for.
Okay.
Then we'll get into treatments, medical options first, pills, different procedures, but also really important, lifestyle changes, diet, exercise, habits, and we'll touch on some natural remedies too, the ones with some science behind them.
Sounds comprehensive. Trying not to make it too overwhelming, though.
Exactly. A solid overview to help you get a handle on it.
Great. Let's start with the causes then. Why does the prostate enlarge like this?
The main drivers seem to be hormonal changes that happen as men age, plus just the aging process itself.
Hormones, like testosterone.
Yeah, specifically how testosterone is processed. It gets converted into another hormone called DHT, dihydrotestosterone, and DHT seems to really encourage prostate cells to multiply.
So more DHT, more growth.
That seems to be a big part of it. There might also be a shift in the balance between testosterone and estrogen as men get older. Relatively higher estrogen could also play a role.
Interesting. So it's kind of a hormonal shift that comes with age.
Pretty much. And those
Yeah.
stats really show the age link, 50% by 60, up to 90% by 85. Age is a major factor.
Are there other things that increase the risk besides just getting older?
Yes, definitely. Genetics is one. If your father or brother had BPH, your odds go up.
Makes sense. Family history.
And metabolic health seems connected too. Things like obesity, diabetes, heart disease, they're often linked with worse BPH symptoms.
Why is that? Inflammation.
That's likely part of it, yeah. Inflammation, maybe poorer circulation in the pelvic area. And lifestyle factors can play an indirect role, being very sedentary, maybe a diet high in red meat and low in veggies. That could contribute to inflammation or pelvic congestion too.
Okay, so it's a mix of factors: age, hormones, genetics, overall health.
Right. It's rarely just one thing.
So how would you know if this is happening to you? What are the actual symptoms?
They can vary quite a bit person to person in terms of severity, but they generally fall into two buckets: obstructive symptoms and irritative symptoms.
Obstructive, like blocking the flow.
Exactly. That's things like having a weak urine stream. Maybe it just sort of dribbles out. Or finding it hard to get started. That's called hesitancy, needing to push or strain to urinate. And that feeling we mentioned earlier, like you haven't fully emptied your bladder afterwards.
Okay, I get the obstructive ones. What about irritative? What does that mean?
Irritative symptoms are more about bladder irritation. The big one is needing to go really frequently.
Like all the time.
Can feel like it. Especially disruptive at night. That's called nocturia, getting it multiple times to pee.
Right, that ruins sleep.
For sure. Also, sudden, strong urges to go. Like you need to find a bathroom right now, even if you just went not long ago. And sometimes, if BPH leads to a urinary tract infection, you might get pain or burning when you urinate.
Okay, those all sound pretty disruptive to daily life. Are there any symptoms that are more serious, like definite red flags.
Yes,
Okay.
absolutely. Some things need immediate medical attention. Seeing blood in your urine is a big one.
Okay.
Also, being completely unable to urinate. That's acute urinary retention, a medical emergency.
Right, that sounds serious.
And signs of kidney problems, like pain in your back or side, maybe with a fever or swelling. That could mean urine is backing up and affecting the kidneys. Also needs urgent care.
Good to know those warning signs. So why do these symptoms often get worse over the years? It's not usually sudden, right?
No, it's typically very gradual. The prostate grows slowly. And initially, your bladder muscle tries to compensate, pushing harder to get urine out.
So the bladder works over time.
Exactly. But eventually, that muscle can get tired, weaker, less efficient. That's when retention can get worse.
Ah.
And if it goes untreated for a long time, that's when you risk complications like bladder stones forming or recurrent UTIs or even, as we said, potential kidney damage from the back pressure.
So definitely better to address it sooner rather than later.
Absolutely.
Okay, so let's say lifestyle changes aren't quite cutting it. What are the medical options?
Right. When lifestyle isn't enough, modern medicine has quite a few tools in the toolbox, from medications to various procedures.
Let's start with medications. What are the main types?
A very common starting point is alpha blockers. Think drugs like tamsulosin, alphazocin, silodosin.
How do they work?
They basically relax the smooth muscle tissue in the prostate gland itself and at the opening of the bladder.
So it just makes the channel wider, easier for urine to flow?
Exactly. They improve the flow, and they tend to work pretty quickly. Often you'll notice a difference within a week or two.
That sounds good. Any downsides?
The main pros are that quick action, and they're good for moderate symptoms. Cons can include side effects like dizziness, sometimes low blood pressure, and a specific one is retrograde ejaculation, where semen goes back into the bladder instead of out during orgasm.
Ah, okay. That's important to be aware of. What's another medication class?
The other main group is the 5-alpha reductase inhibitors, or 5-ARIs. Finasteride and dutasteride are the common ones here.
And these work differently.
Totally different mechanism. They actually block that conversion of testosterone to DHT, the hormone that fuels prostate growth.
So they target the growth itself.
Yes. By reducing DHT levels, they can actually shrink the prostate gland over time, often by about 20 to 30%.
Okay, that sounds like it addresses the underlying problem more. Does it take longer to work?
It does. You typically need to take them for 3 to 6 months before you see the full effect on prostate size and symptoms.
Right. So pros are shrinking the prostate, maybe long-term benefits. Cons.
Cons are mainly that they're slow to act, and they can have sexual side effects for some men. Things like reduced libido or erectile dysfunction are possible.
So alpha blockers for quicker symptom relief, 5-ARIs to actually shrink the prostate but slower acting and potential sexual side effects.
That's a good summary, yeah?
Do doctors ever use both together?
Yes, definitely. For men with more severe BPH, or particularly large prostates or symptoms that are getting worse, combination therapy with both an alpha blocker and a 5-ARI is quite common.
Got it. Any other meds used sometimes?
Occasionally. If someone has a lot of those irritative, overactive bladder symptoms alongside BPH, a doctor might add an anticholinergic medication, like oxybutynin, and tadalafil, which most people know as Cialis for ED,
Right.
is actually also approved for BPH symptoms. Helps relax smooth muscle in the prostate and bladder, too.
Interesting. Okay, so quite a few medication options. What about procedures? If meds aren't enough or aren't suitable?
Then you move into the realm of procedures, and there's a range from minimally invasive to more traditional surgery.
Let's talk minimally invasive first. What's common there?
Well, the long-time gold standard surgical procedure, though it's still pretty involved, is TUROP, transurethral resection of the prostate.
How does that work?
They go in through the urethra with a scope and basically trim away the excess prostate tissue that's blocking the flow. It's very effective, like over 90% symptom improvement.
But it's surgery, right? Anesthesia, risks.
Yes. Requires anesthesia, there's a risk of bleeding, and retrograde ejaculation is a common side effect after TUROP.
Okay. Are there less invasive options than TURP now? Lasers, maybe?
Yes, laser therapies are very common now. Things like green light PVP, which vaporizes tissue, or HOLEP, which kind of scoops out the tissue using a laser.
And the advantage of lasers?
Generally less bleeding than TURP, often a shorter hospital stay or recovery time. HOLEP is particularly good for larger prostates.
I have also heard of UroLift. That sounds different.
It is quite different. UroLift uses tiny implants, almost like little staples, to physically lift and hold the prostate lobes apart, opening up the channel.
So no cutting or heating of tissue.
Exactly. That's the big appeal. Because there's no tissue destruction, it usually preserves ejaculatory function really well. Recovery is often very quick, too.
Any downsides to UroLift?
It's generally best for small to medium-sized prostates, maybe not ideal for very large ones, and there's a chance you might need a repeat procedure later on.
Okay. And one more I've seen mentioned, resume.
Resume uses steam, actually. Targeted bursts of water vapor are injected into the prostate tissue, and the heat destroys those cells.
Steam. Huh. And that's also minimally invasive.
Yes, often done right in the urologist's office. And like UroLift, it tends to have a lower risk of sexual side effects compared to TURP or lasers.
So lots of less invasive choices now. Is traditional open surgery ever needed anymore?
It's much less common, but yes, for men with very large prostates, say over 80 grams or so, an open prostatectomy might still be the best option. That's where they make an incision in the abdomen to remove the core of the prostate.
More effective for the biggest glands, but bigger surgery.
Right. Most effective for extreme BPH, but definitely a longer recovery and higher risk of complications than the minimally invasive routes.
What about older things like TOMT or TUNA, microwave or needle ablation?
You don't see those used nearly as much anymore. The newer options like lasers, UroLift, and Rezum have generally proven more effective and often have fewer side effects.
Okay, so it really depends on the size of the prostate, the severity of symptoms, patient preference.
Exactly. It's a tailored approach. Mild symptoms might just need meds. Smaller prostates wanting to preserve ejaculation might lean towards UroLift. Larger prostates might look at lasers like HoLEP or maybe TURP. Very large, maybe open surgery. It's a discussion with your urologist.
That makes sense. Now, shifting gears a bit, what about lifestyle? Can things like diet and exercise really help manage BPH?
Oh, definitely. Lifestyle changes can be surprisingly powerful. They can work alongside medical treatments, or sometimes for milder symptoms, they might be enough on their own, and they might help slow down the progression.
Okay, let's talk diet first. What foods are good for prostate health?
Some key things to focus on. Lycopene seems helpful. That's the red pigment in cooked tomatoes, watermelon, pink grapefruit. It's thought to reduce inflammation.
Okay, lycopene. What else?
Zinc is important for prostate function. Good sources are pumpkin seeds, oysters, lentils. Omega-3 fatty acids fight inflammation. Think fatty fish like salmon, flax seeds.
Right, the healthy fats.
Cruciferous vegetables, broccoli, cauliflower, Brussels sprouts contain something called sulforaphane, which research links to lower BPH risk. And antioxidants from berries and green tea are generally protective.
Sounds like a generally healthy eating pattern. What
Right.
about things to limit or avoid?
Yeah, some things can definitely aggravate symptoms. Caffeine is a big one. It can irritate the bladder, increase urgency.
Ah, the coffee.
Yeah. Alcohol can also be tricky as it increases urine production, especially bad for nighttime trips. Spicy foods, acidic foods like citrus or even raw tomatoes for some people can also be irritating.
Okay.
And some evidence suggests limiting high-fat processed meats and maybe dairy as high-fat intake might worsen progression.
What about fluid intake? Just drink less.
Not necessarily less overall. Hydration is important, but how you drink can matter. Sip water throughout the day rather than chugging large amounts. And definitely try stopping fluids 2 or 3 hours before bed if nighttime urination is a problem.
Simple tip, but probably effective. Okay, what about exercise?
Exercise is great. Regular aerobic activity, brisk walking, swimming, cycling, aiming for maybe 30 minutes most days, improves circulation, reduces inflammation, might even lower DHT levels a bit. Plus, it helps with weight management, and obesity can worsen BPH.
Makes sense. Anything specific besides cardio?
Pelvic floor exercises, or Kegels. Learning to isolate and squeeze those muscles you use to stop urination midstream. Doing sets of those, like 10, 15 reps, maybe 3 times a day, can really improve bladder control and reduce urgency over time.
Kegels for men, okay.
Absolutely.
Yeah.
And also, try not to sit for super long stretches. If you have a desk job, get up and walk around every hour.
Yeah.
Standing desks can help too. Prolonged sitting can put pressure on the prostate area.
Good point. I've also heard about bladder training. What's that involve?
It's basically teaching your bladder to hold more urine and reduce frequency. One way is scheduled voiding, consciously trying to extend the time between bathroom visits, gradually increasing the interval. Another technique is double voiding. After you urinate, wait maybe 30 seconds, relax, and try to go again. It helps ensure you're emptying as much as possible.
And stress, does that play a role?
Big time. Anxiety and stress can definitely make urinary urgency worse. So incorporating stress management techniques, deep breathing, meditation, yoga can be surprisingly helpful for BPH symptoms.
Interesting link. Any other quick tips?
Yeah, a couple. Be mindful of certain over-the-counter meds like decongestants and some antihistamines. They can sometimes tighten muscles and make obstruction worse.
Oh, good to know during cold season.
Right. And simple things like wearing easy-to-remove clothing if urgency is an issue. Maybe elevating your legs when sitting to reduce pelvic pressure. Little things can add up.
It sounds like these lifestyle changes, while maybe not a cure, can certainly make a meaningful difference.
They really can, and often relatively quickly. Dietary changes might show benefits in weeks. Kegels take maybe 4 or 6 weeks of consistency. Exercise benefits build over 6 to 8 weeks. Managing fluids can help nighttime issues almost immediately.
That's encouraging. Now, what about the world of natural or alternative remedies? There's so much stuff marketed out there.
Yeah, that's a tricky area. It's really important to be discerning. Some supplements have some scientific backing, but many are just hype, and some could even be risky. Always best to be cautious and talk to your doctor before trying things.
Okay, so separating the science from the claims, which ones have at least some support?
Saw palmetto is probably the most famous one. The idea is it might block DHT, similar to 5-ARI drugs, but likely much weaker.
Doesn't work.
The evidence is mixed, honestly. Some older reviews weren't convincing, but newer research suggests specific extracts, lipidostrolic extracts, might offer modest improvement in flow and nighttime urination for some men. The usual dose studied is 300 to 20 milligrams daily.
Pros and cons?
Pros is it generally has very few side effects, maybe mild stomach upset. Con is the quality varies wildly between brands, and it's probably not potent enough for significant enlargement.
Okay, what else?
PGM africanum, from the African plum tree bark. It's thought to be anti-inflammatory. Some studies suggest it helps with nocturia and feeling of incomplete emptying. Typical dose, 100 to 200 milligrams daily. Generally well tolerated, maybe rare nausea.
PGM, got it. Any others?
Beta-sitosterol is another one. It's a plant sterol found in pumpkin seeds, avocados, or as a supplement. Some studies show it improves urine flow measures. Dose usually 60 to 130 milligrams daily. And rye pollen extract, sometimes called Cernalton, has shown some surprising benefits in trials for reducing frequency and pain, likely via anti-inflammatory effects too.
Interesting. What about things that are maybe overhyped or less certain?
Stinging nettle root often comes up. Evidence is really mixed, maybe some benefit when combined with saw palmetto, but not strong on its own. Zinc supplements. While the prostate uses zinc, taking extra zinc pills doesn't seem to shrink BPH. Better to get it from food.
Right.
And definitely beware of anything promising miracle cures overnight. Unregulated supplements can be ineffective at best and potentially harmful at worst. Some contain dangerous ingredients.
Good warning. What about non-pill alternatives, like acupuncture, yoga?
There's some emerging, though limited, evidence. One study showed acupuncture might reduce nocturia, maybe by affecting nerve signals to the bladder. Yoga and stress reduction, as we mentioned, can help manage the urgency component by calming the nervous system. Specific poses might help with pelvic tension.
Bee pollen.
Some very early research on anti-inflammatory effects of bee products like pollen or propolis, but really needs more study. Not established yet.
So, key warnings for anyone considering natural remedies.
Number 1, don't stop taking prescribed medication without talking to your doctor. Natural remedies are generally not a substitute for proven medical therapies, especially for moderate to severe BPH.
Okay.
Number 2, be aware of potential interactions. Saw palmetto and PGM might have mild blood thinning effects, so caution if you're on warfarin or similar drugs. Always tell your doctor all supplements you're taking. Crucial point. And third, quality matters. Look for reputable brands, maybe ones with third-party verification like USP or Consumer Lab, because supplement quality can be inconsistent.
So natural options might offer some mild support, but proceed with caution and keep your doctor in the loop.
Exactly. They might help a bit with mild symptoms over several weeks, but medications generally offer more significant and faster relief, especially as BPH gets more serious.
Okay, this brings us to a really important point. When is it essential to actually see a doctor about these symptoms?
Right. While BPH is common, you don't want to ignore potentially serious signs or let things progress to the point of complications.
So what are those red flag symptoms that mean seek help now?
You need same-day medical care if you suddenly cannot urinate at all. That's acute urinary retention.
Okay.
Also, if you see blood in your urine.
Okay, blood or inability to pee emergency.
Yes. And a fever along with urinary symptoms could mean a serious infection like prostatitis or a kidney infection. Also, significant lower back or side pain, especially with nausea, could signal kidney blockage. All need immediate attention.
Got it. What about symptoms that aren't emergencies but still mean go see the doctor soon.
Definitely schedule a visit, maybe within a week or two, if your symptoms are clearly getting worse despite trying lifestyle changes, or if you're getting frequent urinary tract infections.
Okay.
Also, if you find you consistently have to strain really hard to pee, and sometimes, although less common, if you experience a sudden onset of erectile dysfunction, it can occasionally be linked to severe BPH obstructing things, so that warrants a checkup too.
Makes sense. So what happens at the doctor's office? What tests can you expect?
Usually starts with a detailed history of your symptoms. Then, typically, a physical exam, including a digital rectal exam or DRE.
The DRE, checking the prostate through the rectum.
Exactly. The doctor feels the size, the shape, the consistency of the prostate, looking for enlargement, but also any suspicious hard spots or asymmetry that might suggest something else.
Okay, what else?
A PSA blood test is very common, prostate-specific antigen. It can be elevated in BPH, but also with infection, inflammation, or other prostate conditions.
So it's not a BPH test specifically?
No, it's more of a general prostate health marker. Levels need context.
Yeah.
Generally, under 4 ngml is less concerning. 4 to 10 is a bit of a gray zone, might need more investigation. Over 10 raises more concern. But BPH alone can cause levels to rise slowly over time.
Okay. What other tests might they do?
A urine flow test is very useful. You pee into a special machine that measures how fast your stream is.
Right, to see if there's blockage.
Yes, and often combined with a post-void residual, or PVR check, usually done with a quick bladder ultrasound right after you pee to see how much urine is left behind.
What's considered abnormal there?
A slow flow rate, maybe under 10 millimillisecond, suggests obstruction, and leaving more than, say, 100 millil behind is considered significant incomplete emptying.
Got it. Anything else? Ultrasound? Scopes?
Sometimes they'll do a transrectal ultrasound to get a better image and measure the prostate size accurately. Or if there's blood in the urine or other concerns, they might do a cystoscopy, inserting a small camera up the urethra to look directly inside the bladder and urethra.
Okay, so quite a thorough workup as possible. What should patients be asking their urologist?
Good questions include, based on my tests, what's the most likely cause of my symptoms? Could any meds I'm already taking be contributing? What are all my treatment options, meds, procedures, lifestyle, and the pros and cons of each for me? What lifestyle changes do you recommend most? And how often do I need follow-up?
It's also important to understand BPH isn't prostate cancer, but they can coexist, right?
Absolutely crucial distinction. BPH is benign enlargement. Prostate cancer is a malignant growth. They can cause similar symptoms sometimes, and both can raise PSA. That's why the DRE, checking for hard spots, and interpreting PSA trends are important. But having BPH does not mean you'll get cancer, nor does it turn into cancer. They're separate conditions that can happen in the same gland.
And when should someone think about getting a second opinion?
If you feel your concerns aren't being fully heard, or if you're uncomfortable with the proposed treatment plan, maybe it feels too aggressive, or not aggressive enough. If your PSA is rising without a clear explanation, or if you just want reassurance about a major decision like surgery, it's always okay to seek another expert's view.
This has been incredibly informative. It really sounds like there are many pathways to managing BPH. The source material even included a couple of patient stories that illustrate this.
Yes, they're quite helpful. First, there's John, 58, worked in construction. He really struggled for about 2 years with getting up constantly at night, urgency during the day.
Why?
It was affecting his work and social life.
What did he do?
His primary doc initially brushed it off as aging, but a flow test showed significant blockage. He saw a urologist, started on combo meds, tamsulosin and finasteride, and made lifestyle changes. Cut caffeine, started walking daily, did Kegels.
Did that help?
It helped, but his symptoms kind of plateaued. So he decided to go for the UroLift procedure.
And the result?
6 months after UroLift, he reported sleeping much better, much stronger flow, felt way more confident. His big takeaway was, don't just accept these symptoms. Be persistent in finding what works for you.
Great example of combining approaches. What about the other story? David.
David was 62, retired teacher, very active runner. He noticed gradual changes, but was really hesitant about medications because of potential side effects.
So he took a different route.
Yes, much more focused on natural and lifestyle approaches, working with his provider. He did a major diet overhaul, cut alcohol, caffeine, processed foods, added lots of those prostate-friendly foods we talked about.
Okay.
He also started specific supplements, saw palmetto, pygium, beta-sitosterol, and he incorporated yoga and kept up with pelvic floor exercises.
And how did that work out for him?
After about 4 months of sticking to this comprehensive plan, he reported a significant drop in nighttime bathroom trips and noticeable improvement in his flow. He felt he could manage it well this way and maintain his active life. His insight was about tackling inflammation holistically.
Wow, two different paths, both leading to relief.
Exactly. It really shows there's no single right way. John needed meds and a procedure. David found success with intensive lifestyle changes and supplements. It highlights that personalization is key.
What do doctors typically say about these different approaches?
Healthcare providers often stress, getting objective data first flow test, BVR, to understand the severity. They acknowledge that mixing approaches often works best, maybe lifestyle changes plus medication, or a procedure followed by continued healthy habits. And they always emphasize watching for those red flags and not letting symptoms go untreated if they're severe or worsening. The goal is always a personalized plan that improves your quality of life.
These stories really drive home the point that BPH is manageable. You don't just have to live with the discomfort.
Precisely.
So let's try to summarize the key takeaways from this deep dive.
Okay. First, BPH is super common, especially as men age, but it is treatable. Don't ignore symptoms. Second, early action matters. It can prevent complications later on. Third, treatment needs to be personalized. What works for your buddy might not be the best for you. Talk to your doctor.
Right.
And finally, you have more control than you might think. Lifestyle changes can make a real difference in managing symptoms and potentially slowing progression.
So for someone listening right now, maybe recognizing some of these symptoms, what are some concrete next steps they could take?
Start by paying closer attention. Maybe even jot down notes. How often are you really going, especially at night? How strong is the stream? Any urgency? Just becoming aware is step one.
Okay, self-monitoring.
If symptoms are bothering you, disrupting your life, or if you have any of those red flag symptoms we discussed, make that doctor's appointment. Talk to your primary care physician or see a urologist.
Don't delay if it's impacting you.
Exactly. And generally for men over 50, it's good practice to discuss prostate health, including PSA testing and DREs, with your doctor annually anyway. Be proactive.
That's great advice. Taking that first step, even just tracking symptoms or making the call, seems key. And for listeners who want to take that tracking idea even further.
Yes, we have a great resource based on the source material. You can scan the QR code right there on your screen.
Scan the QR code?
Yeah.
What does that give you?
It lets you learn more and download a free BPH symptom tracker and progress log.
A symptom tracker, how does that help?
It's actually really useful. It provides a structured way to log your daily urinary symptoms, frequency, day and night, urgency level, stream strength, any discomfort.
Okay, like a diary for your bladder.
Kinda, yeah. But it also lets you track weekly lifestyle factors, side-by-side exercise, caffeine, alcohol, water intake, meds or supplements, even stress levels.
Ah, so you can see potential connections.
Exactly. There's a notes section too, so you can write things like, noticed more urgency after coffee today, or started saw palmetto this week. It helps you spot triggers, see if treatments are actually working over time.
And gives you solid data to take to your doctor.
Precisely. It makes those conversations much more productive when you have concrete information, rather than just vague feelings.
That sounds incredibly helpful for taking control.
And within the source material accessed via the QR code, you'll also find other useful bits like info on prostate-friendly foods and things to avoid, maybe even meal plan ideas. Definitely worth exploring.
Okay, so don't hesitate. Scan that QR code on your screen, download the free BPH symptom tracker, and start taking a more informed approach to your prostate health today.
It's about empowerment, understanding your body, tracking changes, and working with your doctor.
Absolutely. Remember, you don't have to just put up with BPH discomfort. Taking that first step towards understanding and managing your symptoms can make a world of difference.